How you doing? My name is Armando. I'm going to be your nurse today. I'm going to perform an assessment on you. Okay?
Okay.
So we're going to focus on some areas of your assessment. It's going to be cardiovascular. I'm going to focus on your vascular area, your abdomen, musculoskeletal. We're also going to do your neuro assessment, and then we're also going to do some male genitalia. So I'm going to start off each system. I'm going to explain to you the findings and if there's any abnormalities, and just tell me if I'm causing any discomfort while we're doing this, okay? So first we're going to start off with your cardiovascular assessment. So I'm going to listen to each point of your heart just to listen to if there's any bruits. Bruits are like blockages in your veins. So we're going to start by doing that, okay? So I'm going to use a stethoscope, but before that I want to use some sanitizer in my hands. Sanitize my hands. Okay, so I'm going to be using this to here, using the bell. So we're going to listen to, first it's going to be the apical, the aortic in your second intercostal. So second intercostal space, I'm going to listen to you. Okay, next is going to be your second intercostal space on your left side. It's going to be your pulmonic. Okay, next is your third intercostal. That's going to be Erb's point. Next is going to be the fourth intercostal. That's going to be tricuspid. And we're moving to your fifth intercostal, which is going to be your mitral. And that is also the apical pulse, where we listen to the maximal pulse. Okay. You can also listen to your carotid, which is, hold your breath. Okay, move to your other side. Hold your breath again. And the purpose of that assessment is to check if you're having any bruits. I didn't hear any bruits, so that's a good sign. Next, I'm going to have you we're going to do your vascular. Vascular, we're going to check your skin, inspect it, see if there's any lesions, any rashes. When I touch you, your skin is warm to touch, and no pain when I touch you?
No pain.
Okay. There's no edema, and you're noted on your arms. Skin color is warm. I'm going to be checking your pulses. Pulses on the wrist. Good pulses, +2. I'm going to be checking your brachial pulses. +2. I'm going to check your carotid individually. Turn to your right, please. Good pulse. I'm going to have you turn to the left. Okay, good carotid pulses. Next, I'm going to be checking your popliteal, which are under your on the back of your knee. Okay, good pulse. +2. +2. Next, I'm going to be checking your posterior tibialis, dorsalis pedis. Good pulse. +2. Any tenderness here?
No tenderness.
Skin is good. No edema noted. No tenderness to palpation on the right leg. Next, we're going to be doing your left. No pain here. No edema noted. Skin cool. Cap refill. Less than 3 seconds. Good dorsalis pedis pulse. Posterior tibialis. Okay. No pain?
No pain.
Okay. Okay, sounds good. Next is I'm going to check your cap refill on your hands. Good cap refill. Less than 3 seconds. Okay, next I'm going to have you lay down really quick. I'm going to do a test. It's called Holman sign. This is a test that we do on patients that have risk for a blood clot or they have pain on their calf, and this is a sign to see if you have any blood clots. Okay? So I'm going to lift up your leg. Any calf tenderness?
No.
Okay. I'm going to have you dorsiflex, which means push down. Okay, and push up. Any pain when you did that?
No pain.
Okay, next on your left one, I'm going to squeeze right here. Any pain?
No pain.
Okay, squeeze down. All right, perfect. Next, I'm going to do check your skin trigger really quick. Okay, no tenting. Since I have you in the lay position, I'm gonna progress to your abdomen. Okay, so I'm just gonna lift up your shirt a little bit. I'm gonna inspect. There's no lesions, doesn't look like there's any hernias, no ascites. I'm gonna be listening to your bowel sounds, and also I'm gonna be listening to some arteries as well with my bell. And then also we're gonna be hopefully checking that the arteries don't have any blockage as well. We're gonna be doing your aortic. Splenic arteries, your renal arteries, and your iliac arteries. So first, I'm gonna just start off by inspecting your skin. Looks like its skin is good. No lesions, no striae, no type of any abnormalities on inspection. I'm gonna listen to your bowel sounds in all quadrants. This is your right upper, left lower, and right lower. I'm gonna start off listening to some bowel sounds. Okay, we usually listen for 15 seconds per each side. Looks like you have active bowel sounds. Next, I'm going to turn over and use my bell to listen to your arteries. Okay, we're going to start off with the aorta artery that's above your umbilicus, and it's above the renal arteries. Okay, I'm going to be moving inferior to your renal arteries that branch off into your kidneys. I'm going to be listening to see if there's any breeze. And your splenic arteries on the top of your left, under your chest. Okay, now I'm going to be listening to your iliac arteries. Okay, there's no breeze noted. Your umbilicus looks like it's centered. It's not protruding. It's centered, so there's no abnormalities there. So next, I'm going to be palpating your, percussing your, actually, I'm going to percuss your stomach. Okay, good sound, good quality timpani sound. Next, I'm going to be checking, it's called McBurney's point. It's to check if you have any, to rule out appendicitis. So I'm going to press down. Let me know if you're having any pain. Okay, so negative to McBurney's. Next, I'm going to check Murphy's sign. This is just check if there's any gallbladder tenderness. Any pain?
Nothing.
Okay, sounds good. Next, I'm going to check, it's called the obturator test. It's just check to see if you have a ruptured appendix. Okay, next I'm going to have you flex your knee, and I'm going to rotate it inward. Tell me if you're having any pain.
No pain.
Okay, so no pain. So your obturator, those are all negative. Next, I'm going to palpate lightly, start off lightly on your abdomen. Just let me know if you have any pain, and then we'll progress into stronger palpation. Any pain?
No pain.
Any pain or tenderness?
No.
Okay, I'm gonna move a little bit stronger. I'm gonna feel if there's any masses, lumps, any abnormalities in your stomach or any deep pain. Will I do that?
No pain.
Okay, sounds good. All right, so next I'm gonna have you sit down and we're gonna move into the muscular checking range of motion on different types of muscles. So we'll work on your first on your trabecular mandibular jaw, and then we'll move down to your shoulders. We'll move to your elbows, knees, ankles, and neck. So and then the back. So what I want you to do is tell me if there's any pain while I do this.
No pain.
Okay, sounds good. I want you to move your jaw, open it, move it from left to right. Okay, no pain? Okay, next I'm going to have you rotate your right neck to the side and then to the left. Any pain when you did that?
No pain.
We're gonna do it with some resistance. Move it now. Okay. This one. Perfect. All right. No pain when you do that.
No pain.
Okay. So your range of motion is good. Now move. Look to the left. Look to the left. Sorry. Move to the left. There we go. This way. Again. Perfect. So next we're gonna do your shoulder. I'm gonna have you stand up. Your shoulders. I want you to. I'm gonna have you move your shoulders back. Any pain when you do that?
No pain.
So we're gonna do a resistance. Do it again. Good. And then now forward. Move up. Okay. No resistance when you do that. So now I'm gonna move your hand to the back like this. Tell me if there's any pain when you do that.
No pain.
Okay, now I want you to move your elbow up like that. Any pain when you do that?
No pain.
Okay. We're going to do this on this side. Move your hand like this. No pain?
No pain.
Okay. Elbow up too as well. Nope.
No pain.
Okay. I want you to shrug your shoulders. Okay, go ahead and have a seat. Actually, sorry, I'm sorry. We're going to have you stand up. Sorry. We'll do the back. Since you're standing up, I'll have you reach down and touch your toes. Okay, no pain.
No pain.
Now I want you to like arch your back. Okay. Any discomfort?
No discomfort.
Okay. Go ahead. You sit for me. Next, we're gonna do your elbow. Work on your elbows. I'm gonna flex your. First, I'm gonna flex your elbow. Any pain?
No pain.
All right. Lift it up. Let me know if you have any pain at any time. Going down. Okay. Flex it again. Flex down. Hyperextend. No pain. Okay. Sounds good. Good range of motion. I'm going to have you do the same thing. All right. Now with some resistance. Good. Go down. Okay. No pain at all when you do that?
No pain.
Okay. So next we're going to have you do your knee. I'm going to have you probably best to lay down. Sorry. Have you flex your knee. All right. No pain. Extend it up. All right. Now extend it down. Okay, now up. Nope. Alrighty. Good range of motion. Bend it. Extend it. Now press down. Okay, up. Okay, good. Good, good. I'm going to do this since you're laying down. We'll do the ankle. We'll do press down. Good. Press up. Alright. Press down. And press up. Alright. Do inward. Outward. I do it inward, both at the same time. And then outward. Alright, good. No. Alright, then I'm going to have you just sit up again. We'll do one more in the back. We'll have you stand up and just kind of rotate you're turning, like you're turning your whole body like that. Like no pain when you twist your back?
No pain.
Okay, go ahead and sit down. Now we're going to do your wrist. I want you to squeeze my hands tightly. Alright. Alright, so next we're going to have you extend your arms like a 5. Go like this. Alright, touch each one of your fingers. Alright, now bend each one of your fingers like that. Okay, when you do that. Okay, move your hands inward. Outward. Okay, again. And go like this and rotate. That checks your elbow, see if there's any pain. No pain at all? Okay, sounds good. Next, what we're going to do is I'm going to check your cranial nerves. We're going to do each test is to focus on a certain cranial nerve. And it's, so we'll start off with your, it's called the olfactory. That's going to be testing for your nose. So I'm going to open up a alcohol pad and just tell me if you smell it. Okay, sounds good. Your next one is it's your optic cranial nerve 2 is your optic. So what we're gonna do, we're gonna perform a test. I'm gonna be checking for your reaction on certain things. For example, like brisk. If your eyes are dilating properly, we're gonna check accommodation, checking like how your vision adjusts, check your peripheral vision. So next I'm going to have you close your right eye, use your right hand and close it like this. Okay, so I'm going to do the same. Tell me if you see what numbers you see. 2. Okay. 3. Okay, sounds good. Check this out. And next we're gonna do it. We're gonna do see what number you see. So, okay. Again. 1, okay. 3, 2, okay, good. Good peripheral vision. I'm gonna check your light. Alright. Keep sitting on my glasses. Okay. Good pupil response to light. Okay, next I'm gonna have you look at this light, look at this pen, and I'm gonna bring it towards your nose and just focus on it, okay? Alright, your eyes focus, there's no stagnance. Also, now I want you to look this way and just follow my pen. And just don't move your head, just follow the pen. Okay, sounds good. So next I want you to do is I'm going to check for the other cranial nerves, which is going to focus on 3, which is oculomotor, trochlear, and abducens. They're all focusing on the eyes, so we're going to focus on doing some testing for that. So, for example, I want you to open up your eyes like that, close them really tight. All right. Okay, there's no drooping. Your eyes are equally symmetrical when you go like that, tightness. Open, like do it again, your eyebrows, put your eyebrows up. Okay, sounds good. So next we're going to be doing the trigeminal nerve. That's going to be the more, it takes care of the face. So I'm going to be palpating your face. Let me know if you have any pain. Any pain when I touch your face?
No pain.
Okay, sounds good. So that's, that is your cranial nerve 5. Cranial nerve 7, we're going to be working on checking the rest of your face as well. I'm checking your mandibular area. Okay, big smile. All right. Okay. So the next one is cranial nerve 8, that's vestibulocochlear. We're gonna do this is gonna be working on the ears. So what I'm gonna do is I'm gonna whisper in one ear, and I close the other one, and I want you to tell me what I said, and I'll do the same thing with the other one. Okay? Okay, sounds good. Close this here.
Very nice.
Okay. Yeah. Okay, sounds good. Good. So the next one, that's a good one that you passed. The next one is cranial nerve 9. So that one we're going to be focusing on the tongue area. So we're going to be doing checking your uvula and checking your gag reflex. So I want you to say stick out your tongue. Okay. Good gag reflex. Next one is the vagus cranial nerve 10. That one will do just swallow for me. Good. So that's part of your tongue and so everything. So it looks like since you're speaking with no difficulty, it looks like your vagus nerve is working properly and swallowing without any complications. The next one we're going to focus on is cranial nerve 11, and that's the accessory one. That one I want you to just shrug your shoulders. Do it again. All right. So good. Then after that, what I want you to do is we're going to focus on cranial nerve 12. That's going to be the hypoglossal. It's the tongue. So just simple. You stick out your tongue. Perfect. So that's good. Next, what we're going to do is we're focus on your deep tendon reflexes. So we're going to use a reflex hammer. I'm going to check your tendon reflexes. Make sure they're not hyperactive. We test them from 0 to 5. 5 plus meaning it's hyperactive. To have some like spinal surgeries, you would be hyperactive if you have that. So I'm going to be doing your brachial. I'm going to be doing your patella, your Achilles, and then also your brachial, patellar, and then your Achilles. All right, sounds good. So we'll start off with your brachial. Nice and relaxed. There it is. Plus 2. Just nice and relax your hand. There we go. Good card right there. Okay, good, good. Next one is I want you to just keep your arm nice and relaxed just like that. We're going to do this should internally rotate. Just relax it nice and good. Just like that. Ah, good, good, good rotation. Nice and relaxed. Sometimes it's a little bit harder to get this one. Okay, so I'll shift a little bit. Good. All right, next one, I'm going to have you actually just scoot back a little bit. Therefore, let's see. Ah, good. Good tendon. There you go. Good. Next, I'm going to be checking your elbow. Tendon reflex. Your tricep. Nice and relax, just like that. There you go. Good. There you go. Okay, I'm going to have you lay down. We're going to check Babinski. Okay, good. It's a positive. Babinski is a good thing. Good, good. It's a good flare-up. Okay, I'm going to have you sit over here. And I'm going to be checking your genitalia. So I would check, when I check your genitalia, I would check, make sure you have any, don't have any rashes. I would first put some gloves on. Always wear gloves when we're using any skin or dealing with any bodily fluids. So I would be checking your genitalia. I would be touching. There's no tenderness, no swelling, no rashes, no bleeding, no discharge. And then be checking for that. And then we would do a digital rectal exam. Make sure you don't have any lesions. Checking your prostate that it's normal. We would also be checking for any type of hemorrhoids, bleeding, and that's about it. So after that, I'm going to be checking my notes, making sure there's nothing that I missed. Okay, so give me 1 second, so we can complete our assessment for today. One more thing that we want to check. I'm going to have you lay down. We're going to check if there's any rebound tenderness in your abdomen. Okay? Use 5 fingers, and we're going to just straight. Okay, there's no rebound tenderness. Okay, Mr. Ramirez, do you have any questions on anything? This concludes our assessment. You seem to be a pretty healthy individual, so we'll call you for our follow-up. Okay. Oops. There we go.